show video link to Naz Shah.
Thank you, Madam Deputy Speaker. Time and time again, the government shows catastrophic failings during this pandemic. The pandemic was not inevitable and no one could predict such things. But when the rest of the world was closing its borders and placing their nations in lockdown, our Prime Minister was boasting about shaking the hands of COVID patients. That was not inevitable. It was a Labour Party comprehensive quarantine policy to protect our nation's efforts and the vaccine rollout from variants entering from across the world. But it was this government that failed to listen and implement the policies we needed. As early as the 16th of March, Madam Deputy Speaker, I was aware that cases were rising in countries like Pakistan, and therefore I submitted a written question to the Department of Health and Social Care asking for the latest data, the government's criteria in placing countries on the red list, and whether countries like Pakistan would be placed on such lists. Madam Deputy Speaker, I received no response to this question. On the very same day, I put out a statement to my own constituents who had questions about travelling to countries like Pakistan, making it clear cases were rising and presumed that Pakistan could be placed on the red list, and reiterated the advice to travel only if absolutely necessary. As a constituency MP, I was able to provide this advice to my constituents on the 16th of March. Again, on the 30th of March, days before countries like Pakistan and Bangladesh were placed on the red list, I wrote to the Foreign Secretary asking him to provide the scientific data before such countries were placed on the red list. In the letter, after listing the countries' rates of infection in countries including France and India, I said in the letter, and I quote, "Given the data, it would be fair to conclude the following. The government doesn't have a coherent strategy in dealing with the red list, and the government isn't serious about protecting the British public as it is applying decisions led by politics, not data." Days later, on the 2nd of April, the government placed Pakistan and Bangladesh on the red list and not India. It then took the government a further 14 days after media pressure to add India to the red list. Figures suggest at least 20,000 people who could have been infected from the Delta variant arrived from India between the 22nd and 23rd of April. This isn't an I told you so moment, because whether it's the Delta variant or the Johnson variant, as it was trending on Twitter last night, the reason for the delay in opening isn't because the British public hasn't played their part. It isn't because the NHS staff haven't worked tirelessly throughout the pandemic and haven't done enough, or because the key workers haven't risked their lives to keep our economy going, or because my constituents or the constituents of other members across this House have not made huge sacrifices. The reasons we are here today is simply because our Prime Minister was more interested in following the politics of a with Narendra and science that would protect our nation's efforts throughout this pandemic. And now this nation is paying the price of that freedom because of our Prime Minister's self-interest and utter failings. The real tragedy is that we have a Prime Minister where failure and callous decisions are inevitable time and time again. Madam Deputy Speaker, the Minister in his opening remarks gave some dates. About 23rd of April, India was placed on the red list, and then the Indian variant wasn't a concern until the week after, the 27th. And like the chair of the Select Committee, the Home Affairs Select Committee, I would also argue that that is a complete and utter nonsense argument. We're either being led by the data or only when a variant becomes of concern. And if we're only being led by the details of a variant becoming a concern, the truth is, as the member for Ellesmere Port outlined very eloquently, that the numbers in India and Bangladesh were lower than India when they were both placed on the red list. So what is the science? What is the data? What has the government got to hide? Why can't they just publish the data from the joint biosecurity analysis and tell us? Because that's all we're asking for. We have a right to know, the public has a right to know, how long is this government going to take us for mugs and give us an argument which just doesn't stack up? The public is not stupid. People are not stupid. We see through this. They can pretend, the government, as it does often in this chamber, the government can give their spiel, but the truth is it was either the science or it was the politics. And there is no other conclusion that anybody can draw but the fact that the science was supporting the closure of the Indian border of India and putting it onto the red list. And our Prime Minister failed because he put politics before the security of the people. And that's, I would urge the good minister to at least publish the data and not hide behind arguments that just don't wash. Thank you.